Hi, everybody. Okay, so I'm gonna read the Tommy the robot nurse helping Italian doctors care for coronavirus patients. All right, guys, just follow along. Doctors and nurses in Italy could use a helping hand. Help has arrived at one hospital in the form of Tommy, a robot nurse. Tommy is one of the 6 new robots helping human doctors and nurses care for coronavirus patients. They work at the Circolo Hospital in Varese. This city in Italy is in the northern Lombardy region, which is the center of the outbreak there. The coronavirus is a flu-like illness. It began in China. It has been spreading across the globe since December 2019. The robot nurses are children-sized with large, blinking eyes. They are wheeled into rooms and then left by a patient's bedside. This allows doctors to look after others who are in more serious conditions. Screens and computers. Gianni Bonali, who is in charge of the Circolo Hospital, described the robot's features. The robot has a screen and a computer, which includes a microphone. Patients can talk to the nurses and doctors through the robot. Robot like Tommy can measure blood pressure and oxygen level. These two measures provide an important picture of the patient's health condition. The robot works on patients in the intensive care unit, including those who are hooked up to a ventilator. A ventilator is a machine that helps people breathe. It moves the air in and out of people's lungs. It's not a way to substitute for human factors, Benali said. That is something that patients rely on, and we know how important it is for them, Bonelli said. Most importantly, Tommy and his high-tech teammates can reduce the number of direct contact doctors and nurses have with patients. Fewer visits could make medical workers less likely to catch the coronavirus. The robot also doesn't need masks and gowns. They help the hospital limit the number of masks and gowns workers have used. Maybe just what doctors orders. The task of fighting the coronavirus has been enormous. It takes a toll on overworked medical staff. However, it takes a while for patients to realize that the robot may just be what the doctors ordered. You have to explain to the patients the aim and functions of the robot, said Dr. Francesco Deltelli. He is in charge of the intense care at the hospital. The first reaction is not positive, especially for older patients. But if you explain your aim, the patient is happy because he or she can speak with the doctor, Deltelli said. More than 4,000 Italian health workers have gotten the virus treating patients in Italy. 66 doctors have died. A lack of masks and other protective equipment has been one of the biggest problems for the health system since the illness surfaced at the end of February. Tommy is the name of the son of a doctor at the Circolo Hospital. Health workers are avoiding going home after their shifts to prevent the risk of spreading the virus to their families. The doctors say, well, at least they have someone next to them that I can call with my son's name, Benali said. It's a way for the doctors to feel at home, Benali said. Tommy and his fellow robot nurses have one more advantage. They don't get exhausted. After a quick charge of batteries, they're back to work.